Now we're going to talk about code blues. I think we're all kind of weird as ICU nurses. I'm not saying we love code blues, but I'm not saying that we don't like to be involved in code blues. My number one rule for code blue is don't freak out. We don't do any freaking out around here. We are trained professionals and we are responders and we know what we need to do. And if you don't know what you need to do, I'm going to talk about it right here. So if you walk into a patient's room and you recognize that, hey, this is not a good situation. Maybe they don't have a pulse or they're not breathing. The first rule, don't freak out. The second rule, call for help. You are going to get very familiar with this precursor signs to a patient coding. As an ICU nurse, we are taking care of the most critical patients, and you get very, very good at identifying, hey, something's up, this is not right. We can typically see that a code is going to happen from a mile away. Not always, there are codes that start kind of just randomly, like you didn't expect the patient to code, but most code blues that happen in the ICU, there are signs leading up to it. We have a patient that is getting more acidotic. They're on 4 pressors. Their blood pressure is tanking. We see a patient that's getting some cardiac changes, arrhythmias, and all of a sudden now they bradied down and they went into PEA. So more often than not, there are going to be signs that your patient's not doing well, and you are going to be seeing these signs because you are the bedside nurse and you are right there. I think we can overcomplicate codes because there's a lot of emotions and it's literally someone dying, but it is quite simple. If you walk into the room, you notice something's wrong, you don't freak out, you call for help, and then you're going to assess the situation. Does your patient have a pulse? If no, you're going to start CPR. If your patient has a pulse, but they're not adequately breathing or not breathing at all, you're going to help the patient breathe. Not literally like mouth to mouth. You're going to use a bag valve mask, hook it up to 100% oxygen, and you're going to bag the patient until all your buddies come in.